This is LiveWell Talk on St. Luke's Telehospitalist Program. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. Recently, St. Luke's started a Telehospitalist Program, which leverages telemedicine technology to serve inpatient care. Joining us today to discuss the program is Chelsea Putz, Manager of St. Luke's Hospitalist Program. Chelsea, welcome to the podcast.
Thank you. I'm glad to be here.
First podcast.
Very first podcast ever.
Welcome.
Thank you.
We're an award-winning podcast.
Oh,
so
nice. It's exciting.
Yes.
Hopefully we can win an award on this one.
Yeah, I think this will certainly be in line with one of the best episodes. But first of all, tell us about the Hospitalist Program. Tell us what it is, how many hospitalists you have, and you could go back to 2005 when it was founded and the leadership back then, which was
an outstanding
amazing
leader. Yeah, absolutely.
Program note, I started the program.
Yeah.
But just tell us, give us the state of the Hospitalist Program.
Yeah, so the Hospitalist Program was founded back in 2005 and have come quite a long ways since that time frame. I think it just started with you and Dr. Reidinger maybe at that time. Yeah. And now we have probably...
You could just simply refer to it as the Golden Age.
The Golden Age.
And people will know what you're talking about.
Exactly.
So go on, sorry.
I won't age you too much with that.
All right.
But now we have probably 13 to 14 full and part-time physicians. And then we have, we just hired a new nurse practitioner and another one will be starting in June. But our Hospitalist Program also sees patients while they're here in the hospital for our family practice physicians or our internal medicine physicians who see patients on the outpatient side. The reason for that is so that those physicians and nurse practitioners can really focus on the patients that are in their office. And it allows the physicians that are here in the hospital to really focus on those inpatients and get them the care that they need in a good and timely manner.
Now, with that program, care for about 90% of the inpatient census for the most part?
I would say yes.
You know,
there's only two physicians within our community that we don't actually see their patients.
Dr. Sohn and Dr. Nelson, I think there's only two that still come to the hospital.
Yep.
Which credit to them. I mean, they very hardworking and very solid physicians. But so this really is this was a national trend, started in probably 1993 out in California. And when I started in practice in 1996, it had started then. You know, we were dividing up duties from that way. So it does increase efficiency. But what you give up in what you gain in efficiency, you might lose a little bit in continuity.
Yeah.
So what does your team do to maintain continuity? So if I'm a patient admitted to the hospital, the hospitalist team's going to care for me. How does my family doctor know what happened? What's going on? If I've had any problems?
Yeah. So all the H&Ps are sent directly to your family physician. And we also have 5 hospitalist nurses that kind of help divvy out those patients who are admitted overnight or on our swing shifts. And they really look back at the patient's chart to see which hospitalist might have seen them previously so that you continue to have that continuity of care, especially if our physicians are going to be signing off of service and maybe someone admitted that patient or had seen them a few days prior. They will get that patient back so that they really know that patient and they know the family and the things that they need for this particular hospital stay. The other thing that kind of helps is our hospitalist nurses will also follow that patient from the time that they're admitted until the time that they're discharged. So, you either have the continuity with the physician or you have that hospitalist nurse who you're very familiar with and who is familiar with your care that you're receiving during your hospitalization. And then after you leave, we also send that discharge summary to your primary care physician so that they're well aware. If there's anything that really needs to be followed up on, our hospitalist nurse or the physician will make a direct call to the patient's family doctor to ensure that they are getting the proper follow-up care post-discharge. Okay.
Well, that does sound like you have a system in place, particularly that hospitalist nurse. In full disclosure, I work typically weekends as a hospitalist just because of my full-time commitment during the week, as well as this award-winning international podcast that's listened to.
Yeah.
But those nurses do really help with continuity, I think. I think that's a huge plus. And decreases length of stay and decreases readmission and helps with compliance and particularly follows through on pending laboratory work, pending diagnostic studies to keep that continuity flowing. And we have a UniPoint Clinic does a nice job getting the patients in, correct? I mean, in a timely fashion.
Yep, absolutely, yeah. We were able to get a hold of their office in a pretty timely manner. We try to get our patients in within 3 to 5 days.
Yeah, I mean, that used to be very difficult to achieve. Yeah. It was very difficult to get them in a timely fashion. I think you guys would make great strides in accomplishing that.
Yeah.
Particularly under that 7 to 9 day mark, where if you go out beyond that, you increase the chance of readmission. As I said, you care about 90% of the admissions to the hospital. So that's well close to 140 patients a day, roughly. I mean, that potentially that'd be about 100%. So a little bit less than that. And you have staffing issues like any other discipline in healthcare right now.
Yep.
So to help with those staffing issues, you try to leverage some technology. Tell me about that.
Yeah. We started utilizing Telehospitalist back in September. As you mentioned, we do have our own staffing issues, and what trying to do with those staffing issues is really still keep that good quality care that we have always kind of prided ourselves on, that we do a great job in readmissions and length of stay and providing a good patient experience to all of our patients here within the hospital. So we started utilizing telemedicine because those physicians are already within UnityPoint. So they have the same metrics and qualities that we're looking for in our physicians, where historically we have used a lot of locums. So physicians that come from the outside that aren't invested into our organization. And so we started utilizing Telehospitalist, telerounding back in September. Our Telehospitalist, we just hired a new one, Dr. Taure. He's a part of our Cedar Rapids team. And so I think what's kind of pretty cool about Telehospitalist is that they still have the ability to kind of conduct the listening of your heart and your lungs by using like a virtual stethoscope. Which is a really nice quality, so that you still feel they're still able to kind of get that hands-on approach. And then they utilize our hospitalist nurses to help with any other assessment needs.
Yeah, that technology, I'm sure, has come a long way. Is it pretty accurate? I mean, what's your thought on it?
Yeah, it's very accurate. They have different sound waves that you can kind of change it to, and all of the physicians have a headset, and so they can kind of adjust things on their side. One of the things that you really have to be cognizant of is like making sure that there's not a shirt underneath the stethoscope, and really getting that close skinned contact. Otherwise you do get the sounds from the rubbing of your shirt or something like that.
The movement of that.
Yeah.
So it's maybe extra sensitive or ultra sensitive.
Yep.
That makes sense. Take me through the process. I mean, what is it? Is it like a little Zumba that comes in the room?
Yes. No. It's basically like a really big computer almost.
Okay.
There is a monitor that the patients can see Dr. Taure from. And then above that is a camera, and that camera can go around 360. It can zoom in, it can zoom out, and really, if you have a family member sitting off to the side, Dr. Taure or even any of our other telehospitalists will kind of move his camera to that direction so that he can see and talk to that family member and ask them to introduce themselves and introduce himself to the patient. So if you had a patient maybe with cellulitis and he really wanted to get a good look at that leg, he can zoom into very, very fine details of that leg.
Interesting. What do patients think of it?
It's new, and so with that, we have had patients who definitely feel a little uneasy about it, but after kind of talking through with them, you still will receive the same quality of care. There are still in-person physicians here available if something does happen. Definitely put them at ease. We've had some great comments that people have really appreciated the care that they've had with Dr. Taure and have felt like they've been able to make a connection through with that relationship, even though it is virtual.
Tell me but you do have some care guidelines as far as like they don't do critical care, perform procedures, etc.
Correct.
Tell me about that a little bit.
Yeah, so we still do have those guardrails where they don't see those critical care patients or those patients who, maybe require a lot of that are very sick. They'll see more of your basic patients who maybe come in with your cellulitis or your chest pain, things like that. But if one of their patients does have maybe a rapid response or a medical emergency, they will still show up. But if it requires that the patient needs a higher level of care almost, we do have our in-person physicians take over.
Yeah, we do have the rapid response team.
Yep.
Which has responded to those since September 2006, I think, is when we started responding to all code blues and all rapid response back then, MET teams back then.
Yeah.
So the patients have been, it's new.
It's new.
Do you self-select? Do you say, okay, this patient's not the best at hearing, they're older, they're confused, let's not?
Yeah, we will do that.
So you kind of look at that sort of situation?
Yeah, we'll look at that. Definitely don't give them patients who might need an interpreter. You have the ability to have a 3-way call with an interpreter and the patient, but I think that starts to get a little bit hairy whenever you have 2 people kind of talking to you virtually. So we do try to do it that way. If we do come across a patient that maybe is hard of hearing or it's a little bit more difficult for them to understand, we'll certainly have the hospitalist nurse kind of help relay any messages, or if it gets to a point that we need to give them an in-person physician, we do that as well.
I mean, in theory, if you could have a database or a panel of physicians, and if the patient spoke Spanish and you had a telehospital that spoke Spanish, you could connect those two. That. What's the farthest that someone's away physician? Just out of curiosity.
I think the first one that we had start with us lived in Michigan.
Really? Okay.
Yes.
Interesting.
Yeah, that's the farthest. I don't know that we have a telemedicine service line, and so they, I think, are spread throughout the country. I don't know the furthest.
They could be. I mean, they could be on the International Space Station for all I know.
They could be in Mars, the moon.
There's not people on the moon.
I know.
Chelsea.
We could pretend.
Okay. How'd you get into nursing?
Oh, man. When I was a little kid, I always, like whenever my parents were sick or anybody was sick in my house, I thought it was the coolest thing to go get the old mercury thermometer and take somebody's temperature and trying to get them to feel better. And so I always enjoyed doing that. And then I always have enjoyed science and anatomy and biology. And so I thought, why not go be a nurse? So I went to nursing school in 2008 and started on 5 Center.
Yeah, I remember.
As a nurse there. And I just really enjoy taking care of people. I love the science behind it. And that's why I became a nurse. Yeah, absolutely.
Well, you've done a nice job in your leadership program with the Hospitalist Program. You really have.
Thank you.
And credit to the Dr. Edwards and her leadership. I mean, I really think the program's in a good position overall. I know you guys are understaffed and busy, but
yes.
You have some good doctors. I'm very proud to help out with that program. Once again, this is Chelsea Putz, manager of the St. Luke's Hospitalist Program. For more information on all services available at UniPoint Health Cedar Rapids, visit unipoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.